Good afternoon, everyone, and good morning in some cases. And thank you for joining us for today's webinar, COVID-19 and the HRST Scoring Impacts. This training today is brought to you by HRST, the health risk screening tool. Before we get started, I want to tell you about something that's exciting. There is a study that has been recently published, and when I say recently published, I mean pretty much today, on the HRST. It was published in the peer-reviewed Journal of Nursing Measurement. The title of the study is an examination of the validity of the health risk screening tool, predicting mortality in people with intellectual disabilities. And the study has a lot of good information in it, but just to jump right to the conclusion, the HRST can predict mortality. Therefore, it can serve as a basis for establishing healthcare needs and determining nursing care acuity. So all of you who are using the HRST know that you have, or you are using a tool that has been further validated in that it can predict mortality. So let's go ahead and introduce our speakers for today, and we'll start off from right to left. Sherry Neal, it's an RN, BC, CDDN. She has worked in the healthcare profession since 1972. She's board certified in 2 nursing specialties, gerontology and developmental disabilities, and is also an NTG affiliated regional trainer for dementia-capable care for adults with IDD and dementia. Sherry's worked for over 25 years with people with intellectual and developmental disabilities and over 35 years with the geriatric population. Sherry was a master nurse trainer for the state of Illinois for delegation of medication in community settings. And Sherry will be our main presenter and also our final presenter today. Brandon Lancaster is our Director of Information Technology. Throughout his career, he's amassed experience across the field of information technology, including information security and platform development. His primary responsibilities here at HRS is to oversee the continued development, implementation, and support of our tools, such as the HRST. And he'll be talking to you in our middle segment today. And my name is Craig Escude. I am a board certified fellow of the American Academy of Family Physicians and the American Academy of Developmental Medicine. And I'm also the president of Health Risk Screening. I served as the medical director of Hudspeth Regional Center in Mississippi, and while I was there, I founded the DETECT program, which stands for the Developmental Evaluation, Training, and Educational Consultative Team of Mississippi. I've worked in the field for well over 20 years, clinically providing medical care for people with intellectual and developmental disabilities and complex medical conditions, and I'm the author of the Clinical Pearls in IDD Healthcare and the Curriculum in IDD Healthcare. So with that, we're going to get started with our talk today. A brief overview. We're just going to touch on the latest information that we have right now about COVID-19, and I'll be doing that. And then we'll move into how to use the HRST reporting suite to capture very important information. And then Sherry will spend the majority of the time with us today talking about how COVID-19 impacts scoring in the HRST. So what indeed do we know today? Well, we know, don't we all know, that we're dealing with a disease called COVID-19. CO for corona, VI for virus, D for disease, and 19 for the year it was discovered, which was December of 2019. It is one of the coronaviruses. In particular, it is called the SARS-CoV-2 coronavirus. Now, coronaviruses have been with us for many years, hundreds, probably thousands of years. They were first discovered, though, in the 1960s. Coronaviruses do come in different shapes and forms, and they are responsible for somewhere between. So when we get runny noses and coughs and sneezes, a fair amount of the time they're caused by coronaviruses. But some strains like COVID-19 and SARS can be much more dangerous. There are viruses that have higher rates of death than the current coronavirus that causes COVID-19. The Ebola virus has about a 50% death rate. The SARS and MERS, those are both coronavirus diseases. They also have a much higher death rate. SARS about 9.6% and MERS somewhere between 20 and 40%. So even though we're dealing with about 2 to 3%, which is still quite significant, fortunately, we're not in the range of some of these other viruses. Currently, there is no vaccine for COVID-19. People are avidly working on that right now, as I'm sure you're all aware. And what's interesting right now is what we're talking a lot about is about immunity against coronaviruses. And we just cannot conclusively say at this time if someone has had an infection with COVID-19, if they will have immunity, to what degree they will have immunity, how long it will last. I believe that there will be some degree of immunity, but again, we don't know how long it will last, and all of these things are current. We talk about COVID-19 and transmission, and we know that there are two big ways that the virus is transmitted. One is from person to person. And what's important to remember about this is even in people who don't show symptoms, the virus can be transmitted, especially before they start showing symptoms. That's one of the highest times that viral illnesses are transmitted, and they're transmitted through respiratory droplets. So it's important to try to stop spreading respiratory droplets by coughing in our elbows or in our hands or using masks. All of these types of things can be helpful. And we'll touch a little bit more about that in a minute. And then also through contact with contaminated surfaces. It's very, very important to keep all surfaces clean. And on the next slide, you'll see a few different time periods where we know that the coronavirus can live. So up to 4 hours on copper, 24 hours on cardboard, days on plastic and stainless steel. So what is our take home? We need to clean, we need to sanitize in order to prevent transmission. So let's talk about some very general prevention guidelines. We know these things, but we can't hear them enough. We need to remember to wash our hands for at least 20 seconds, use a hand sanitizer that has at least 60% alcohol. Keep our hands away from our face, especially our eyes, our nose, our mouth. Avoid close contact with others who are ill or infected. Stay home if you are ill, cover your cough or sneeze, and regularly clean and disinfect objects like light switches, keyboards, cell phones, and eyeglasses, and so on and so forth. So, who is at risk for the most serious effects? The CDC says that people who are over the age of 65, who have lung disorders, heart disease, immune deficiencies, and severe obesity are at most risk for serious complications from a COVID-19 infection. Some people with IDD, we know, have decreased respiratory capacity, especially if we look at people who maybe have cerebral palsy. They may have difficulty fully expanding their lungs, taking deep breaths, having effective coughs, people who have asthma, and also people who have frequent pneumonia or chronic silent aspiration. We know that anytime we have infections in our lungs, it can cause scarring and damage, which can cause further problems should someone get a significant or get an infection like COVID-19. In talking about who's at risk and where do we get information, we want to remember to always do our best to get information from trusted resources. The Centers for Disease Control, the National Institute of Health, the World Health Organization. Look to organizations that we know can give us good information, not social media, to determine what we should or shouldn't do each day. And when we're looking for information that's specific to this condition and people with disabilities, again, look to organizations that have always provided trusted information. Anchor at anchor.org has some great information out there, some clinical, but also a lot of legislative information and policy information about what's going on. The Administration for Community Living at acl.gov has a number of resources for clinicians. Both the American Academy of Developmental Medicine and Dentistry and the Developmental Disabilities Nurses Association have a lot of clinical information. For direct support professionals, I'd encourage you to look at the National Association of Direct Support Professionals website, and also health risk screening at HRST online. We have a number of resources, some previously recorded webinars, a health passport that you can download, and some other information. So besides health risks to people with disabilities are also at risk for losing supports when something like this happens. Many people rely on either family members or support staff for their usual activities and to be fully integrated in life. And those people can become ill themselves or have an ill family member. They may have difficulty finding childcare, or they simply could become overworked and burned out. When we look at agencies, there's been some changes, and agencies have been forced to close down day programs. They may lose operating funds. They may not be able to stay open or be fully staffed, and then it may be difficult to return after a pandemic. So these are all things that we need to look at and consider and plan for as things change. I'm going to touch now on just a few general preparedness guidelines to think about. We want to continually and regularly monitor for signs and symptoms in the people that we support and our staff. And if we find that there are symptoms that could be COVID-19 related, we need to first notify the healthcare providers. What I would recommend, and this is my recommendation, is not to immediately take someone to an emergency room if they have symptoms or show up at a doctor's office. The people who are being admitted to hospitals are people who have really significant symptoms and need in-hospital care. And if we're taking people who maybe just have a little fever and a cough because we're concerned that they might have it, we might be further exposing other people. We might be stressing staffing that we know is challenging at this time. So the first thing we want to do is contact our local healthcare provider, and they may be able to provide healthcare or recommendations over the phone. Also, if you have telehealth available, that's also a really good option to use right now. Other items include ensuring an adequate supply of the person's medications. If you can get 90-day supplies, that's ideal. And you can work with insurance companies. They're changing policies and regulations to allow that to happen. Also ensure that you have an adequate supply of regular types of what we call cold meds, cold medications, decongestants, medicines for fever. Have those on hand as well. Have usable thermometers. If you can get the no-touch ones, those are best. You might also want to consider a device called a pulse oximeter. You probably are familiar with those. They're very easily obtainable now. You can get them online, and they can provide some helpful information to a physician on the other end of the phone or a nurse on the other end of the phone that can help guide treatment. There is a learning curve associated with those, so you do need to know how to use them properly, but they can be very helpful. We want to utilize delivery services for things like groceries and other household items. Wearing masks is recommended when you're in a group setting at this present time too, so we should take care to do that as possible. We know that it's difficult. Some people don't do well with wearing a mask, but we always have to try to do the best that we can. Having a list of emergency contacts for each person that is updated and ready and available. Look around homes and programs and see where might be the best place to isolate someone if someone does need to be isolated or quarantined. We always want to try to keep a calm and a controlled appearance and environment, because just like viruses are contagious, so are our emotions sometimes. And if we are exhibiting a lot of anxiousness and anxiety, that can be transferred to other people around us and can make things sometimes a little more difficult. I would encourage you, if you don't already, to utilize a document called a health passport. There are several you can find online. We have one online, at hrstonline.com. That is our health passport. And a health passport provides information about some basic medical conditions that a person might need to know, say if they're being transferred to a hospital or to a physician's office, or maybe just to another home. It provides basic demographic and medical information. But what's really nice about it is that document provides information about that person as well, how to best support that person, what other things are needed, how does that person identify when they're, or let someone know that they're in pain, how does the person know, or what are their likes, what are their dislikes, what are calming techniques. All of these things can be very helpful should someone need to move to another environment quickly. So I would encourage you to either download it, or, as most of you on this call are users of the health risk screening tool, we are rolling it out this week as an integrated update to the health risk screening tool. And if you don't already, by the end of the week, you should have it in each person's record, and there'll be another tab in their record, and you can complete the health passport there. And so you'll be getting more information about that soon. A few other general preparedness guidelines include modeling good hygiene. If we want people to wash their hands, we need to wash our hands. If we want people to clean, we need to clean. Educate people at appropriate levels of information. Help people, give them information that they can understand and digest at their level. Teach people that you support about good hygiene measures. Don't forget about pets in the house. And I'm not so much talking about the pet getting COVID and spreading it to someone, but if a pet is moving from room to room or area to area and different people are touching the pet and petting the animal, they could be transferring material, infectious material from one person to another too. So consider that as well. You may want to create quarantine kits. Quarantine kits have a number of items that if someone needs to be quarantined very quickly, you won't have to go searching all over the place for different types of items. So masks, goggles, gloves, gowns, disinfectant spray, alcohol wipes, antibacterial soap, additional hand sanitizers or other sanitizers, and also think about a mattress, air mattress, and bed sheets should a staff or support member have to be quarantined with that person, and then throw in a few snacks as well. And the last thing I'll talk about is we want to ensure whenever possible that people maintain their usual routines. We know it's difficult, but when people's routines changes, that can cause some anxiety and agitation. So, maybe we can keep a similar routine, but do it a little differently. If a person needs to visit their family or they usually visit their family on Friday afternoons, maybe you can turn that into a virtual visit. If you go shopping on Tuesdays, you can go virtual shopping, but try to keep routines the same as much as possible. We again ensure access to medical care and consider telemedicine if you're not using it already. Take care about what's watched on television because people do become anxious. And I know if I sat around all day, watched the news and what was going on and the way things are portrayed in very dramatic ways, I get anxious. So we want to be careful about what we all are watching as well. Because again, those emotions can be contagious too. Stay informed about what's happening from trusted resources, and then utilize tools that you already have to identify who is at most risk. And that includes the health risk screening tool. And with that, I'm going to turn it over to Brandon Lancaster, our Director of IT, and he is going to talk to you about some reports and how to pull some reports that can help you identify people who are at most risk for serious issues. Brandon?
Thanks, Greg. All right, so let's talk about the HRST report suite. So as all of you HRST users know, the HRST contains a vast amount of data, and it's very valuable. And really understanding how to properly utilize the standard and custom report functions within the application will allow you to put that data to good use. So I think I'm going to move into a live demonstration of how to utilize the standard in custom reports, as opposed to taking you guys through slides in a PowerPoint, because I think it'll help you guys understand it a bit better. So I'm going to move now into our training database. And just to note here, this is training data, so all of this information is fictitious. No need to worry about any HIPAA violations here. And as I log in, let me go ahead and make it a point to mention that there's a lot to cover here in regards to standard and custom reports. So I may move through this a little bit fast, and I apologize for that, but we do have a timetable to stick to. So with that said, you guys have access to download the slides for this webinar, and within that PowerPoint, there are slides that cover what I'm going to discuss today. And towards the end of the PowerPoint or the presentation, we'll give you guys access to some resources so you could reach out should you need help regarding standard reports or custom reports. So let's go ahead and get started. First thing I want to talk about is standard reports. Standard reports can be accessed in a couple different ways, and standard reports really serve a couple different purposes. Standard reports are available by default in the HRST system. That means that these are reports that either HRS has built on their own or we've built for customers, and they serve to report specific data that is widely useful to users as a whole. For example, if you want to see somebody's healthcare level change over time for a specific period of time, say a week, a month, 6 months, a year, that would be a standard report, something that we find people pull often and need to run reports for that data often, so we build them into what we call standard reports. Now, the first place that you can access a standard report is from the person served list. Now, this list here is a list of all the people that I serve. And in order to access the standard reports from this page, I would simply choose the reports drop down at the top and hit standard reports. Now, before I do that, just one quick note about the data on this page. It is filterable. So if, for example, I only wanted to see people that I serve that have a healthcare level of 4 or higher, I could toggle this healthcare level filter at the top here, and the results in my person served list change. And I can see now that I only have 268 entries. If I were to run standard reports now, the results that I get would only be based on those visible in the table now. For this demonstration, I'm going to open that up to all of the records in the database, just because I want to get some good data for demonstration purposes. So clicking into the standard reports option from the reports menu, I'll be served a pop-up here, and I can note that I am on the person served list reports by seeing the header. And all of the reports that are available to me are within the folders here, and they're organized based on what type of report they are. Let's go ahead and take a look at a sample. Let's pull BMI info, which will show individuals' current height, weight, and calculated BMI value. Now, this one's important because persons who are obese are prone to experience a more severe illness related to COVID-19. So if I wanted to run a report like this and narrow down people that I serve that might be, on a higher BMI value, I can do so using this report. Now, when I select a report, I have the option to choose a couple different or a few different report formats. I can do web, which will return the results in a similar pop-up to this one. I can choose PDF or Excel, which will simply download the respective file based on what I've selected. Let's go ahead and use the web format for now. I'll click Generate Report, and I can see that now I have a list of all of the BMI entries for all of the people in my person served table. You'll note that there are multiple entries because each person can have multiple BMI recordings throughout their history. And again, I can utilize this data to kind of narrow down people that might be more susceptible to complications with COVID-19 based on their weight. Now, I mentioned there are a couple of, there's another place that you can run standard reports from, and that is from an actual person served record. So if I were to click into a person served record, let's say Roosevelt Adams, for instance, and I access that same standard reports menu item from the reports dropdown, I'll get the same type of pop-up, but I'll notice that instead of being in the person served reports pop-up, I'm now in Roosevelt Adams reports pop-up. And that means that any report that I run, we can also notice that there's different report options. Any report that I run will be based on just data in Roosevelt Adams profile. So again, I apologize if I'm moving through this quickly. You'll have access to resources should you have any questions after this webinar. So moving on from standard reports, let's talk about custom reports. Custom reports are, or the custom report builder, I should say, is a pretty powerful tool in the HRST. And we find that it's often underutilized because either A, users don't know about it, or when they come across it, it's a little daunting. So I'd like to kind of dispel some of that worry or concern that this piece of functionality is hard to use, because it's rather quite easy to use, and it'll give you the ability to pull some specific data that might not be available in standard reports. So to access custom reports, you can do so from anywhere in the app. You would go to the reports dropdown and choose custom report builder. Now, unlike the standard reports, the custom report builder, anything that I build here is not reliant on the filter that I've applied to the person served page. This will return results from the entire database of individuals that I have access to see their records for. So the first thing that I'll notice when I come to the custom report builder is a section where I choose columns for my report. Now, again, this looks a little daunting. I know there's a lot of data here, but what these essentially equate to are data points within the application. So we'll see first name, middle name, last name, date of birth, healthcare level, email, birthplace. Really, this is all data that we have inside a person served record. And if a column is toggled on, that means that it will be visible in my report when I run it. If it's toggled off, it means that it's not going to be visible. So this is a way for me to specify which data points I want to show in the report that I build. In this case, I'm just going to stick with first name, middle name, last name, and date of birth, and healthcare level. Down below the column selector, I'll see the criteria section. This is really the engine behind the custom report. This is where I specify what criteria I want to run the report based on. So a very simple example would be, let's say I want to return every person that I have access to see with a healthcare level of 3 or higher. I would choose healthcare level from this first dropdown, choose a relation of is greater than or equal to, and set a value of 4. If I were to run this report, I would see an output that shows all of the columns that I've selected above, and the results on the report would be people that I have access to see that have a healthcare level that is 4 or higher. It's as simple as that. Now, I'd like to give a more pertinent example of using the custom report tool. I'd like to give an example of a custom report that might indicate who are the most susceptible to a serious infection or have a greater likelihood of having serious consequences to an illness like COVID-19. And in order to do that, I would like to target specific rating items for each person's record. And I can do that, again, by selecting options from this field dropdown. So the first piece of criteria that I'd specify in this example would be item A. Let's say they have a score that is greater than or equal to 3. And again, this just means that if I were to run this report as it is, I would only see person served records where they have scored 3 or higher on item A in their HRST score. And I'm choosing item A because people that score 3 or 4 on item A can be at greater risk because of their increased risk of potential aspiration episodes. So that's why I'm targeting that score. I'd also like to see people that score 3 or higher on item P. And item P is important because people with diabetes will score 3 or higher, which, as we all know, people with diabetes are at higher risk as it is. And in addition to that, nutritional compromise is included here as well. So people that score 3 or higher have nutritional compromise. In addition to that, I'm going to add item Q. And this one isn't a range. We all know that item Q can only be 0 or 4. So I'm going to choose equals 4. And 4 is important because, item Q is important because it's for high risk treatments. Those who score 4 here are at higher risk for a number of conditions, including respiratory conditions, and they're among the most fragile and susceptible to significant illnesses like COVID-19. And finally, let's add a criteria for item T. And we're going to do, again, is greater than or equal to 3. And item T is important because it's for professional visits. So people who score 3 or 4 here, they could be at greater risk of contracting the virus if these visits that they have take place at hospitals or clinical offices where they may be exposed to more people with illnesses. And just a quick note about this criteria that I've built. As I was going through this, you probably noticed that I selected or here in between each criteria piece. This just means that when I run this report, I want to see records, I want to see persons served records that meet any of these criteria, meaning I want to see somebody that scores A greater than 3, greater than or equal to 3, or P greater than or equal to 3, or Q or T, so on and so forth. That means that I'm sort of casting a wide net here, and I will return more results with people that might have one or many of these. If I wanted to narrow that down a bit and sort of cast a more narrow net and capture individuals or persons served records that meet all of these criteria, I can change these to ands. And that means that I only want to see records that meet all of this criteria. And again, if that doesn't make too much sense now, or you have extra questions on that, feel free to reach out after the webinar and we can give you guys some more data on how that works. But for now, let's go ahead and leave it as ors. And before I run this report, I'm going to also draw attention to this field here, add to my custom reports. This gives me the option to name this report. And when I run it, and when I hit get custom report, what this does is it adds it to a log of custom reports that I have run and built in the past. And that, I can show you that here in a moment, but that gives me the ability to rerun this report at future date without having to rebuild it. So that's set. Let's go ahead and choose Get Custom Report. And we can see now that based on the criteria that I specified, there are 426 people that I have access to in this database that meet the criteria that make them more susceptible to a serious infection like COVID-19. At the top of this page here, I can export this to Excel. I can export it to PDF. I can also click into Show Options and change the criteria and update it, and then run it again if I choose to. But that's essentially it. Now, I mentioned previously that if you name that report, it adds it to your custom reports, and that can be found from the Reports dropdown under My Custom Reports. This section here will show you any custom report that you have built and named in the past. And I mentioned that you can quickly rerun it by either A, clicking this title, which will take me back to this results page. In real time, it'll recalculate the results. So if something in the database has changed since the last time I run it, this will be new data. In addition to that, I can easily export it to PDF or Excel from this line. I can choose to delete it if I don't want to see it anymore. And I can choose to schedule it as well. So on that note, let's talk about scheduling reports. Both standard and custom reports can be scheduled. To schedule a custom report, you can either do so from this button here, or you can do so from the reports results page by clicking the report scheduler. Clicking the report scheduler will take you to this report scheduler page. We can see that I am on I'm making a schedule for the report that I just ran, and I have the option to choose how often I want this report to run. I can choose, let's say, for example, I want to receive this weekly. I'd like to receive it every Monday, and I'd like to see it in my inbox at 9 a.m. Once I choose that the frequency and the reporting options, I choose how I want it delivered. I like to see my results in Excel, so I'll choose that, and I'll hit Schedule Report. This means that every Monday, on a weekly basis, I will receive an email from the HRST letting me know that this report has been run. I can click the link, it'll ask me to log in, and it will download the report for me automatically. So that's scheduling custom reports. And in addition to that, you can also schedule standard reports. So let's go back to the person served list. Let's rerun our BMI info report. And similar, I would choose the report format of web, and I see the same button that I did on the custom report output. Clicking that would take me to the report scheduler where I can schedule that report. Now that said, I know that was a lot of data. I'll reiterate one more time that you'll have some resources provided to you at the end of this webinar, so you can reach out should you have any questions on how to utilize either the standard reports function or the custom report builder. So now I'd like to turn this over now to Sherry, our clinical director, who is going to discuss scoring impacts. Sherry, just one sec. Let me pass this over to you.
Good afternoon, everybody. And I'm going to move fairly quickly too, because I have a lot of information to share. We're going to talk about how COVID-19 can affect the scoring on the HRST. Hold on a second. Okay. Depending on the severity of the condition, it can affect all 22 rating items. So when you look through the HRST after a person has had COVID-19, always look at all 22 rating items. And we're going to look at a couple of rating items from each of the categories so that we can see, once a person is diagnosed, how this disease can change scores. And it can change them a little bit, or it can change them dramatically. So category 1 is functional status, and I'm going to look at item E. So if a person already has difficulty breathing and swallowing and are an aspiration risk, they're going to be a bigger risk now. With this respiratory illness, they're going to have more problems. So watch those folks very closely. Fatigue can affect their ability to feed themselves or eat without other interventions. And anytime we see that, anytime a person becomes more dependent on others, they have a higher risk for aspiration. Fever can reduce their appetite, so they may require to be hand-fed or have nutritional supplements, which will affect item P, nutrition. And the score could be 0 through 4, depending on their abilities. If they have a mild case of the disease, they may be 0 if that's what they were before. But we want to make sure that if they have a score of 3, they're partially fed by tube. So we want to make sure that they may end up being fed totally by tube, and be NPO. Because if they were partially fed by tube, now they've got this severe respiratory condition and they can't eat at all, so they'll be fed by tube. If they're on a ventilator, if they're in the hospital and they're on a ventilator, they can't eat when they're on a ventilator. It's impossible for them to eat. So what they do is, within 24 to 48 hours, the healthcare practitioner will provide some kind of alternate nutrition, meaning it could be tube feedings by nasal gastric tube or oral gastric tube. It could be total parenteral nutrition, which is it contains all the nutrition that you need and is administered intravenously. Actually, it's administered in through an artery or a deep vein because of the problems that are associated with it. But we don't let people starve just because they're on a ventilator. Item E, if there are no symptoms, but the persons are asked to stay at home like the general population, there will be no change in item E because it's for everybody. This isn't just separating out the persons with IDD. This is for everyone. So there should be no change in item E. But if they have any symptoms, we can see an increase in healthcare practitioner visits. So I've found the benefit of telehealth visits. I think they're wonderful, but they may also be seen in the office. They may have ER visits, hospitalizations, labs, x-rays. We want to count the days in isolation. So if they actually have the disease and they're not hospitalized, we want to count all the days that they're in isolation. And remember, what we're doing here is counting the number of days that are affected, not the number of events. So a person can have increased aggression, they may have a telehealth visit, they may have a seizure, and they're in isolation. All of that is only going to score for 1 day. Okay. We may also see an increase in mental health issues if they are isolated. And if I were isolated in one room and a bathroom, I think I would have an increase in mental health issues. So we often see depression or anxiety or an exacerbation of self-abuse or aggression. And we may see an increase in seizures because the disease may decrease their seizure threshold. So watch out for those. Category 2, behavior. We are looking at behavior support chemical and psychotropic medications. Behavior support chemicals are PRN psychotropic medications, so they're given on an as-needed basis, not a routine basis, and they can be given for an increase in a lot of different things. Self-abuse or aggression if they have an as-needed medication for that, or anxiety or sleep. Maybe the person is very lethargic and they sleep all day and then they can't sleep at night. They may need some sleep medication on a PRN basis, just as they need it. Psychotropic medications, we may also see a temporary increase in current routine scheduled medication, or they may have new medication added to control anxiety, sleep, behaviors, and depression. These may be a temporary increase so that after their disease is controlled and they're able to come out of isolation, 2 or 3 weeks down the road, they may not need these medications anymore and they will be tapered off and discontinued. But it could be a long-lasting event as well. Category 3 is the physiological category, and remember, this is the category that we think of having the most healthcare issues. So item N, skin breakdown. If the person is very lethargic, they're very tired, they don't feel good, they've got a fever, and they sleep a lot, they may lay for long periods in the same position. So again, they're becoming more dependent, they need more supports in their life, so someone has to reposition them. And staff need to be trained in how to reposition someone and prevent pressure on bony prominences. You could also see if the person has an NG tube, the nasogastric tube, or the orogastric tube, which is an OG. If they have that for more than 2 weeks, typically the healthcare practitioner will insert a gastric tube. So a gastrostomy tube will be inserted. So that surgery, even though they just puncture a hole and put in a tube, that's still a significant skin disruption because we often see infections around those. Self-abuse can cause a lot of skin breakdown depending upon the seriousness of it. Persistent diarrhea sometimes occurs with new tube feedings. When they first start, their body's not accustomed to tube feedings, so they develop some diarrhea. This disease also may reduce our ability to fight off other infections, such as Clostridium difficile, commonly known as C. diff. It's a very severe diarrhea, uncontrollable most of the time, and it's an infection on itself. So we don't want that infection on top of the COVID-19. And it's hard to get rid of. So item Q, there's some situations that may apply in item Q because of some hospital issues that occurred in the hospital or at home. If they have a tracheostomy, if they require a ventilator for long term, they typically don't leave just a tube down their throat. They do a tracheostomy and put the hole in their neck so that they can breathe. So they may have to have suction daily, and this should be for 14 consecutive days in order to score item Q. If they're ventilator dependent for 7 consecutive days or more, we'll score item Q. If they receive nebulizer treatments daily for 30 consecutive days, anyone that's on a ventilator will typically receive nebulizer treatments while they're on the ventilator, and then after they're better and the ventilator is removed, they may still require nebulizer treatments. That's very common. So 30 consecutive days may be very reasonable for them to receive nebulizer treatments. Daily or more frequent deep suction for 14 consecutive days, and this is deep suction. This isn't just suctioning in the mouth and the throat. This is going down at least 6 inches into the airway or below the voice box. Sliding scale insulin, if the person, a lot of times when a person is admitted to the hospital with diabetes, they take them off of their oral medication and put them on sliding scale insulin so that they can control their blood sugar more closely, because if their blood sugar is high, they're not going to heal as well, they're not going to repair any tissues as well. So they put them on sliding scale insulin to keep their blood sugar at a very tight, within a very tight range. They also may have IV or peripherally inserted central catheter access. Now, we're not sticking them every day, but these things have to be flushed every day, and that counts as access because there's still the chance of introducing bacteria into the line, so there's still a possibility of infection there with item Q. A PICC line, if you've not seen a PICC line, they're typically in the underside, they're inserted in the underside of the upper arm, and they'll have 2 or 3 little dangly things from it, and that's how you can tell if it's a PICC line or not. And if the person has to have one-to-one staffing for behavioral purposes, not medical purposes, only behavioral purposes, for 14 consecutive days. So if they start becoming very aggressive and having property damage, or they're very self-abusive, they may have to have a one-on-one staff. And for the HRST, one-on-one staffing is with arm's length for all waking hours. So that could be 10 hours, that could be 14 hours, it depends on how long they sleep. It could be 17 hours if they don't sleep very much at night. But remember, it's for behavioral purposes only. Category 4, I went ahead and chose both of the topics here because these are the only 2 rating items in Category 4 safety. So we can see injuries and falls both. We can see injuries related to the falls or the self-abuse. If they're aggressive and they're, putting their hand through a window, and we see injuries related to that. Or if they pull out the endotracheal tube while they're in the hospital. Or if you're an agency that provides ventilator support and they have an endotracheal tube. This is the tube that goes down into their throat that connects to the ventilator, and it's got a balloon on it so that that's what holds it in place within the trachea. So it could impact behavioral support physical. So if you go visit the person in the hospital, which they're not going to let you in right now, but you may notice that their hands are restrained very tightly, and that's because that we don't want anyone pulling out this endotracheal tube. It is extremely hazardous if they do that. It can cause lots and lots of trauma, and it can also cause death due to bleeding and whatever's in the tube getting into the lungs. So we have a lot of issues with people pulling out endotracheal tubes, and some people that are very mobile and very dexterous can use their feet to pull out the tube, and I've seen that happen before. So you may also notice that they've had restraints on leg restraints to keep their feet down as well. Falls can be caused by anything. It can be from the bed and the chair when they're walking, but delirium is an acute medical condition. It's confusion, but it comes on suddenly, and it's related to the severe disease process, or it can also be related to, like in ICU, there's always buzzers and bells and intercoms, and the lights are always on, so they don't know night from day, and that can cause delirium as well. But it's an acute condition, so it's not Alzheimer's, it's not dementia, it's an acute condition. And falls can also be intentional. and that would rate under falls and behavior. That would be self-abuse. Frequency of services, professional healthcare services, we can see an increase obviously in healthcare visits. So it could be an office visit or a telehealth visit. We will count both of those. Labs, x-rays, all of those kind of things that are going to occur for any person that has COVID-19. Now they can come out of, we'll talk about isolation here in just a minute. Category 5 is frequency of services, like we talked about earlier. It can also, I chose to do all 3 of these because frequency of services, item U ER visits, and item V hospitalization can all be affected. So ER, unfortunately, is where most people go for a diagnosis. And if they don't have something when they go in, they'll probably have something when they go out. So sometimes it's best to contact their own healthcare practitioner and try to get a visit with them if possible. If they don't go to the ER and they go to urgent care or a walk-in clinic, this needs to be for an urgent condition. So if they think they have COVID-19 and they're coughing and they have a fever and sometimes they have general body aches, it's best to go get tested. So if it's an urgent condition, they can go to urgent care and a walk-in clinic, and we can count that as an ER visit. Item V, hospitalization. A lot of times they're admitted through the ER. When you write your comment for item U, ER visits, and item V, hospitalization, always put the date of the ER visit and the date of hospitalization. And if there was an ER visit that resulted in a hospital admission, put the date and reason that they were admitted to the hospital. So they can be admitted through the ER, they can be a direct admission, or we also want to make sure that you count all hospital admissions. So if a person goes to their acute care hospital while they're acutely ill and they're weak, they still can't just go home, they may be admitted to an ICF or a rehab facility, and that will score for item T and item V, hospitalizations. It will score 2 hospitalizations, even though it's for the same condition. So if they went to the acute care hospital, then to a rehab facility, and then to a long-term skilled nursing facility, that would be 3 hospitalizations because they're just not ready to come home yet. So when should you re-rate the HRST? When the person is discharged from a higher level of care facility to home. So if they end up in that skilled nursing facility as their last stop before they get to come home, that's when you want to re-rate your HRST within 7 days of their discharge and coming home. Look at all 22 rating items because you don't know what they have, what's happened with them. And when the person is no longer considered to have the disease, which currently they're considered to no longer have the disease if it has been 7 days and they have been 3 days without fever. So let me repeat that, 7 days and 3 days without fever. They're considered that they can come out of isolation. So when you re-rate, review all 22 of the rating items, obtain as many of the hospital records as you can, because remember when you're scoring the HRST, you can use what happened in the hospital. That doesn't mitigate the risk. They still have the risk. So if they had PRN psychotropic medications, that's going to score under item I. If they had physical restraints in the hospital, that's going to score item H. If they had new medications added, that's going to score as well. So look for all of those things. Maybe their seizures increased. Maybe they had a wound and they were in the hospital long enough that it healed. So if they had a pressure injury or bed sore or pressure ulcer or whatever you're familiar with, and it healed during the hospitalization, they are still going to score, and that is a permanent score if they have ever had a pressure injury. So item N will continue to score 2 for the rest of their life, at a minimum of 2. So always try to get as much information as possible. So Craig, do you want to talk about this?
Yes, sure. Thanks, Sherry, for that review. That was excellent, and Brandon as well. So, additional resources. We want to remind you that at the HRSTonline.com website, we have a COVID-19 page. On that page, there is information relating to an infection control video that is available for anyone to watch. We have 2 other webinars at the present time that have been recorded and have a lot of information that you may find helpful. And yes, there's some specific information on there as well too, and also other information that you might find helpful, special bulletins that can be as help as well. So we are here to help. You all have, you know how to contact us through your support email addresses that you were given, or you can click the contact support button on your HRST login page should you have any specific information or specific questions or need any specific information about running these reports. I'll also mention that there's a video on the HRST Online website that has that tells you how to run these reports as well. So again, we thank you for joining us today. We hope that you have found this helpful, and we hope that you join us for future webinars. We look forward to seeing you again.